Every step you take should feel natural. But what if your knees start hurting every time you walk, climb stairs, or even just sit too long? For millions of people, knee pain is not just an inconvenience, it's a daily struggle that slowly steals their mobility, independence, and even their confidence to move. And here's the truth. Most people treat it completely wrong. They ice when they should strengthen, they rest when they should move, and they pop painkillers without fixing the real issue. Today, I'm going to break down the 3 main causes of knee pain and show you exactly how doctors think about diagnosing and treating them, so you can finally take control of your knees before the pain controls your life. First, osteoarthritis, the rusty hinge of the knee. Think of your knee joint as a hinge on a door, smooth, frictionless, and built for millions of cycles. But over time, just like a hinge left out in the rain, the smooth cartilage that cushions your knee begins to wear away. This is osteoarthritis, the single most common cause of knee pain, especially after age 40. The protective cushion thins out, bones start grinding against each other, and the joint becomes inflamed and stiff. Here's the science. Every extra kilogram of body weight adds nearly 4 kilograms of pressure on your knee with each step. That's why weight management is medicine for your joints. Doctors focus first on lifestyle. Losing even 5 to 10% of body weight can significantly reduce pain. Then comes physiotherapy. Strengthening the quadriceps and hip muscles works like installing shock absorbers that stabilize the hinge. For persistent cases, we may use hyaluronic acid or platelet-rich plasma or PRP injections to improve lubrication. Or in advanced damage, joint replacement surgery becomes the definitive fix. The key with arthritis is not waiting until the joint is rusted, shut. Early action slows the process dramatically. Second, ligament or meniscus injury. The rope and cushion tear. Now picture your knee as a tent. The ligaments are the ropes holding it steady, and the meniscus is the cushion inside that absorbs shock every time your foot hits the ground. A sudden twist on the football field, a bad landing while running, or even stepping off a curb the wrong way can snap a rope or tear that cushion. This is why athletes dread hearing the words ACL tear or meniscus tear. The pain is sharp, the swelling comes fast, and many patients describe that awful sensation of the knee giving way or locking up. The doctor's approach is stepwise. We begin with the RICE protocol: rest, ice, compression, elevation to calm the acute inflammation. Then physiotherapy takes over, strengthening the surrounding muscles to offload stress from the injured tissue. For mild sprains and small tears, this alone often works wonders. But for severe or unstable tears, especially in younger or athletic patients, we consider arthroscopic surgery, a minimally invasive repair or reconstruction. The goal is always the same: restore stability, protect the joint from further damage, and get you moving again. Third, patellofemoral pain syndrome, the movie-goer's knee. Ever sat through a long movie only to stand up and feel an ache behind your kneecap? That's patellofemoral pain syndrome, often nicknamed movie-goer's knee. Here, the problem isn't damage to the cushion or hinge, but misalignment. The kneecap doesn't track properly along the femur, causing friction and irritation. Why does this happen? Usually due to muscle imbalances. Weak quads, weak hip stabilizers, or even flat feet can throw the entire biomechanics of your knee out of sync. Doctors rarely recommend surgery for this. Instead, the cure lies in retraining your muscles, strengthening the quads and hip abductors, stretching tight hamstrings and calves, and sometimes using orthotics to correct foot posture. With consistency, most people see dramatic improvement in a matter of weeks. The beauty is that most people improve significantly with targeted exercise, no surgery required. The doctor's golden rule for knee pain: motion is lotion. Here's the truth that surprises most patients: the worst thing you can do for knee pain is stop moving completely. Your joints are like sponges. They need motion to pump in nutrients and lubricating fluid. Whether you're dealing with arthritis, an old injury, or patellofemoral pain, the right kind of targeted movement heals and strengthens your knees far better than rest alone ever could. In essence, your knees are not designed to be a lifelong source of suffering. Whether it's the slow wear and tear of arthritis, the sudden trauma of a ligament or meniscus tear, or the frustrating misalignment of patellofemoral pain, there are precise, science-backed treatments that go beyond masking pain and actually correct the underlying problem. Remember, the earlier you act, the better your chances of keeping your knees strong for life. Protect your knees and they will carry you strongly through every step of life. See you next time. Keep watching MedGroww and take care of yourself.